Hello and welcome back. I want to share with you a recent case study. I saw a young man, mid-20s, very athletic, who has had chronic hip pain outside of both hips. Started on the right, then moved to the left. It's kept him from biking, it's kept him from working out. He has pain sitting. He works with a PT kinesiologist and is really struggling. In one visit, I found and fixed a lot of things using PDTR and chiropractic. He's also been in two major accidents, multiple bike accidents, mountain biking, as well as car. And when he walked, he would sway off to the right, and his torso was leaning, his hips were not rotating, his abs were not rotating when he was walking. So things are really stiff. I used PDTR and found a lot of things. We weren't able to access his system initially because he had a pain receptor in his outer knee, and we were able to clear that up, figuring out exactly what point was disrupted and stimulating correctly and making that neurologic correction. Standing, especially in a squat, he was weak. He didn't have any stability, pressing him from front to back, as well as he had a lot of weak muscles. Both sides, glute medius, which are the outer hip muscles, piriformis, which is the hip rotator, psoas, which is a major hip flexor, rectus femoris, which is his quad, as well as his right glute max, his left obliques and transverse abdominis, so basically his deep core. So a lot of things were just not firing, period. And then he had hypertonic muscles all over the place, meaning muscles that are compensating for that weakness. His hamstrings, both bilaterally, his gastrocnemius, his popliteus, which is the muscle behind the knee, and his QL, which is the deep muscle in his back, sartorius, which brings the leg up and out, and his right quad, his right glute max, his left obliques and transverse. So basically half his body was weak and half his body was compensating, and that's probably the pattern he's been in for years. So we followed protocols of PDTR, proprioceptive deep tendon reflex, and was able to change everything. The fire normally turning on and off correctly, with finding an impact paleo, which is a compression of his right femoral head, and left medial collateral ligament had a neo, which is basically like a pin stimulation for pain. Stimulating both of those, hitting a deep tendon reflex, resetting the entire system. And he walked out of here with all his muscles working, having more spring in his step. We were able to stress test it with him running, squatting, doing things, and they were all holding. So again, using PDTR, finding and correcting the aberrant software, which is firing in the body, only then can you allow the hardware to correct, which is doing the chiropractic adjustments, soft tissue work, and all of that. So better living with PDTR.